but I've collaborated with a partner where their design was based on this model. They have a therapist at the table, they have a prescriber at the table, and they surveyed all the youth in their neighborhood. And also youth on TikTok who helped them design this technology.
Hello and welcome. Today we have our special guest, Dr. Ronki Kumalafe, founder of Advancing Integrated Health, Jeremy Henderson-Teelucksingh, counselor coach and consultant at Indigo Path Collective, and Dr. Sarah Such, licensed behavioral health counselor at Penn Medicine, Lancaster General Health. Welcome, everyone. Thank you for joining us today.
Thank you for having us.
Great. Let's start with our first question. Tell us a little bit about your background and how you became involved in artificial intelligence and technology within the field of integrated healthcare.
Thank you. Thank you for the introduction and for having us to be here today. Technology has always been fascinating, and I started my career in mental health in a mental health clinic, and then I transitioned to a health plan, and then working for Medicaid, and then I got bored and decided to take time off working and focus on my doctoral degree in behavioral health. And while I was doing that, I started to research my areas of passion. And then I ended up getting connected to one of my friends who introduced me to a health technology company. They needed a compliance officer. And in the world of compliance, it's all about policy. That's what I thought. Well, when I came on board, it was much more than just policy. It was really about staying on track about the regulatory trends coming in for Medicaid, how to gather the reports, how to make sure the workflow is reflective in the EHR, and working very closely with regulatory agencies. I did that for about 3.5 years, and I started to get bored, really bored. My team, nobody would believe that. Everybody thought I loved it, which I loved the regulatory and policy aspect, but there was some technical aspect that were beginning to fall into my role. Once I started to oversee other aspect of it. So I started to do research and I fell into artificial intelligence. While doing my research, I decided to connect with one of my friends who was really deep into technology. And he introduced me into a technology of voice to diagnose technology, where you can use it, you say your name, just 3 words, and it would diagnose you, tell you what's wrong with you and the steps you need to take to address this. This was back in 2019. And that's how I made that transition, in 2020. That's how I made that transition from healthcare EHR, just focusing on EHR, into focusing into digital health and focusing into artificial intelligence, specifically artificial intelligence for mental health.
Oh, okay. Wow, what a journey.
Yes.
All right.
Well, I currently work in integrated behavioral health. I work out of a primary care practice in a large health system, and I have a background in also community mental health and substance use treatment. And one of the things that I noticed throughout the pandemic as I was working on my doctorate was that we just did not have the resources to treat the number of people who needed care. A lot of the work is falling on primary care providers who are not always equipped with the tools necessary to make accurate diagnoses or offer effective treatments, which is why I have the role that I have. But we just couldn't keep up with the influx of patients. Our team was getting 1,000 referrals a week at certain points.
Wow.
So when I was working on identifying a culminating project idea for my doctorate, I wanted to do something that looked ahead at how we could actually continue to serve patients and improve care. And technology was, it's an answer that's coming up a lot. And so I wanted to be on top of it. And so my culminating project was on the use of AI and technology in healthcare settings. So.
Right.
Gosh, my experience coming into the healthcare industry is a little bit different. in that I was in the technology industry for about 25 years, working for companies that most of us would know, like VeriSign, which was the check mark on the bottom of the page, is now owned by Symantec. So whenever you buy anything that's about security online, or eBay, Salesforce, these types of companies. And similar to Dr. Komalafi, I got bored and I expanded my career into clinical mental health. And so to me, it's just a natural place to be focused on how do we utilize technology to improve healthcare altogether. Recently, I was working as a fractional COO for a company that's, for example, looking at how do we create better referral systems, right, to match patients to providers so that we can improve health outcomes more quickly with lower barriers. But there are lots of different companies out there doing very interesting things. And like Sarah said, I think it's so important for us to just really know what's going on. There are too many companies for any of us to know all the things, but there are a lot of companies out there doing some very interesting work that can definitely benefit and accelerate patient outcomes.
Okay, wow, great. What has been your journey in integrated artificial intelligence and technology with other healthcare disciplines? And what motivated you to pursue this path? I'm hearing boredom consistently through here. I want to dive a little bit deeper into that.
Yeah, mine definitely was boredom. I felt, I mean, working in an EHR world, everybody made everything about the EHR. And for me, there has to be a better way. My uniqueness working in the EHR world was I came from the clinic, right? I worked in the clinic, I worked in Medicaid, I worked in a health plan. So I was able to see the perception and the view that a lot of my colleagues were not able to see. And I felt like there has to be a better way. There has to be an easier way, because I could feel the pain of the clinicians when they complain.
Yes.
Or feedback about the technology. And I could also, to some extent, see the perspective of the tech folks. So a lot of the times my tech colleagues necessarily didn't hear the clinicians' feedback request, nor did they hear mine. So I wanted something more simplified. So, which is what led me to AI. My first experience with AI was with this technology that I mentioned earlier, where first I did a lot of research to be sure I was going to be interested in that. And with this technology, I got to really sample it a lot. You speak, you talk to it, it tells you what's going on with you, literally from about when you were 3 years old until that very day. It's not overwhelming, it's very simplified, and then it gives you some music and meditation you can do, to kind of center, ground yourself and to walk through things. I got more interested when I was in Germany and my best friend was in Mexico having a tough time. She's also a DBH. And I decided to try the technology on her. I've always used it on myself. It was almost like just another device I just carried around because I was just curious doing my research. And I had her speak into it. And it told us a lot about her, things that I would prefer that it did not say. I knew these things. Of course, she's my best friend, so I knew about 95% of what it gave us, but I still felt it was an invasion of privacy. So I did after that, I never used that device again. It was just,
okay.
It was scary, very scary.
Makes sense.
She would not use it either. So I did take about a year and a half off at that point using that particular device for mental health, but I did dive into other AI and other aspects of my business because due to the recession, the Great Resignation, I could not find someone to hire. I decided there has to be a better way. So while researching there has to be a better way, I came across a lot of AI that could help with our marketing mostly. And that's how we adopted AI. And once I started using AI, every time we have a problem, I try to see if AI can solve it before I hire someone. And that's how it just keeps going. And once I was able to fully immerse myself into AI, I sat on the board of a few not as much, but I did sit on the board of a few mental health apps. We all started using AI, using the
Mhm.
algorithms, the biomarkers, and the different aspects to see how much we could push better outcomes using
Mhm.
AI in
Mhm.
mental health. So that was my exposure. That's how much I've used it.
Mhm.
Almost all the mental health apps I have worked with, collaborated with, or sat on their boards have adopted the use of AI into their technology.
Wow. What a journey. And I see your motivation. Definitely, definitely.
For me, so I haven't done direct work integrating any AI into practice, but my motivation and what I'm looking at is coming from patient care and provider care. And I look a lot at the ethics of using some of these technologies. So
Mhm.
there are, to Dr. Kamalafe's point, there are so many options out there, and patients more and more, and this is anecdotal, I don't have research behind it, but patients more and more are kind of expecting to have Amazon-like service for their needs, right? They want something
Right.
that is readily available, it's convenient. They don't really want to have to, wait for an appointment, which is the reality. I'm thinking if you need a specialist provider, you might be waiting months for care. Um, which is too long when someone's in crisis or not doing well. And so you've got patient expectations, and a lot of folks are turning to digital technology and digital health
Mhm.
interventions
Mhm.
without really knowing if they're effective or if
Right.
they're safe or how their data is being used and stored. And then from the provider side of it, a lot of these technologies that really could do a lot to improve patient care and improve health outcomes, they're not being implemented in ways that are really good for the provider. They're spending more and more time in charts, um, answering messages, not getting
Mhm.
reimbursed for that time, and they're really burned out. And patients are also expecting providers to have that really broad overview of their entire health history and hold it in their head. So they're kind of expecting this AI-like performance out of a provider, which I understand. That's going to give you the best health outcomes if your provider really knows your background. But when they're seeing 15 plus patients a day for 15 minutes,
15
it's,
minutes.
yeah, it is. I just
Wow.
really think that technology and implementing it and using it effectively is going to be the thing that kind of helps manage the provider shortages that are going on right now.
Absolutely.
I'm really interested in this for two big reasons,
Okay.
kind of opposite end reasons, if you will. The first is the idea of increasing speed and accuracy in healthcare.
Mhm.
And so when we talk about AI, I think that it's important for us to acknowledge that this is an umbrella term for a lot of different types of technologies that
Yes.
exist under this one category. And so that, if we just want to be really basic about it, we could say it's a database, right? It goes into the back end, it picks up some information based on a an algorithm, so a set of steps that are described by the system in which you're working, and it pulls this information and brings it forward. So that to me is a really important piece because we can speed things up, and we know
Mhm.
that historically, just when we look back at the tech industry in general, what used to take football fields of machines can be done
Right.
now simply on your laptop. And
Mhm.
the other side of it that I find very fascinating is tech phobia within the healthcare industry. And
Tech
so there's
phobia.
a lot of, right, there's a lot of good
Yeah.
reason for that tech phobia to be there, such as the threats that come through HIPAA violations or the potential of a HIPAA violation. And we know that healthcare technology, healthcare data, excuse me, is
Mhm.
the largest amount of data that exists out in the world. And so we also know that there are massive amounts of breaches that keep
Mhm.
happening over and over again. So there's a big place for cybersecurity firms to step it up, but we also have to recognize that with every change in a algorithm, comes another hacker who can kind of potentially work to make, get in there and make a breach. So there's this idea of tech phobia, though, that I've noticed when I talk to healthcare providers about it and name it, the resistance comes really far down when I have those discussions. And so I think we just have to name it to tame it, because the reality is healthcare providers, just like anybody else on the planet, are using smartphones. And it's something like 95% of adults in the United States, if I'm remembering the stat right, is using a smartphone. They're already using technology, and they're already using AI technologies based on just what's on their device. So when we connect those two things in the minds of providers, I think there's a better opportunity to accelerate health outcomes and reduce barriers to access to care, because the provider understands the basics of the technology, and so they're able to accept that a little bit more readily than I think what happens when we just use the term AI alone.
Good point there. Good point there. How has incorporating artificial intelligence and technology into integrated care models impact patient outcomes? Can you share any specific examples or success stories?
Sure. I think when we talk about artificial intelligence and technology to support what Jeremy said, it's always nice to break it down. A lot of times when we talk about artificial intelligence, everybody's thinking, GI, generative AI, but there's several types of AI, and all these types of AI do different things. And in healthcare, we'll use the different types of AI. For example, in healthcare, we've been using AI, to my knowledge, for the past 15 years. Anyone who has population health, who has used algorithm to gather data, to curate the data, to identify the gaps and implement interventions with a population health management tool, has been using AI. Back then, we didn't call it AI. We just talked about the algorithm, right? And now we call it AI. So it's really nice for us to say what type of AI that we're using. We say there's 7 types of AI, but we really have to look at it based on the capabilities, and then we have to look at it based on the functionalities, right? So when we talk about AI capabilities, we're looking at artificial narrow AI, and then general AI, which is like the ChatGPT, which is the most common type of AI that everybody can relate to. And then we have the super AI. And then when we talk about functionalities, we're talking about reactive machine, artificial intelligence, we're talking about limited memory AI, and we're talking about theory of mind AI, or the self-aware AI. So specifically for this, for the questions I'm answering, I'm just going to use a general AI term instead of breaking down the AI. I have seen AI being used for specific success stories, especially when it comes to population health management. When I managed an EHR company, working there, we adopted the population health technology that we incorporated into the EHR. This technology is able to use artificial intelligence based on the specifications you feed it to develop a population, curate the population, and help us develop using predictive analysis, identify individuals within the population we've given it who need to be incorporated into a population health management program. For example, a population health management program for diabetes, for example. You feed this technology the data, and it's able to identify specifics of what needs to be done for an individual based on predictive information of what they've done in the past and what has happened to them in the past, so we can improve outcome. That's the most common ways and stories that I have seen AI being used successfully, and ways that I have seen technology being used successfully. There are other ways I have seen AI being used, for example, in radiology, where AI is being used to quickly interpret X-rays. When this has been done, I have seen, especially in cancer centers, them use this technology to then integrate care for a patient. For example, once a patient is diagnosed as having cancer due to the rapid AI interpretation, most cancer centers, for example, like Inova, Cancer Center of America, and a few other cancer centers will immediately incorporate mental health by bringing a therapist to talk to the person and give the person a therapeutic care where they can continuously talk to a therapist, and if needed, even bring their family to come talk to a therapist. The quick identification of individuals going through this using artificial intelligence has definitely helped improve outcome. And I can speak to this based on some individuals in my life who have gone through this.
Okay. Thank you for sharing that.
One of the things that I've been seeing crop up within the organization where I work is the use of AI and other technologies to reduce administrative burden for providers.
Oh,
So I
that's
figure
great.
since Dr. Kamala had talked about diagnosis in particular, I can look at the administrative side of it. So freeing up time for providers to be working with patients. The thing that they generally want to do, actually talk to their patients and interact with people, versus the writing the notes or writing work excuses or things like that. So there's some technologies out there that are helping to do scheduling,
Mhm.
kind of listen to the provider in the room with the patient and write the note that can then be reviewed by the provider and signed, helping with wait lists for patients, so getting people into treatment as quickly as possible when cancellations come up. And I know I'm missing some other pieces that it's able to do, but that's one of the exciting things, is just taking some of that administrative burden off of folks of the tasks that they're not really in the field for. Um,
Right.
the other the other thing that I wanted to touch on is access to care. So folks that may not be able to get to a human behavioral health provider,
Mhm.
for example, Jeremy was saying, 95%, we aren't totally sure on the number, but somewhere around there, folks have access to smartphones and
Mhm.
might have data plans that would allow them to utilize a conversation agent AI. So some of these technologies and apps are allowing people to receive cognitive behavioral therapy, motivational interviewing, mindfulness, acceptance and commitment therapy interventions, um, through a conversation agent. So
Mhm.
one of the really cool pieces there is it's rapid access and it's available when a person is in a crisis or struggling, which may not be the case for their human provider. Now, it might be
Wow.
3 in the morning
Mhm.
and they can they
Right,
can log
right,
into
right.
that app and
Mhm.
get some support right in the moment. So that's one of the really exciting treatment pieces that I've been seeing.
Okay.
There's a so in the late 1990s, there was a group of web companies, like agencies that developed websites, and one of them was Razorfish, and it was founded by this guy named Jeff Datchus. And at that time, it was Razorfish, CKS, US Web, right? These kind of Sapient, Scient, Viant. These were the names of the companies that existed. Fast forward 20 years, I'll say. I don't know, maybe that's making me feel a little like gray haired on the side all of a sudden here, but
Yeah, mine are here, so I'm with
right, right. Fast forward, and Jeff has produced another company called OneDrop. And this is an
you.
organization that is looking at diabetes, high blood pressure, weight, these sort of things. But I think it's a fantastic example of integrated behavioral health because they apply both the health coach, so you can text with a health coach, have this interaction that seems to be more of a human interaction, but then there's predictions around when your blood glucose is going to drop, or what your progress is, or food choices, making recommendations, these sort of things. And so in a lot of ways, it's doing exactly what we're all talking about, is combining the use of technology to predict what the person needs, not like right now in this moment, but also what's
Mhm.
coming in front of you, so that you know what to plan for, so that you
Mhm.
can live a healthier life. And so I think it's a great example of integrated health. And if I'm remembering correctly, Jeff started that because he experiences diabetes, if I'm remembering his story that he's open about online. So the point there that is really important to me, though, is that we've got to have both patients and providers designing these things so that it's more effective for folks. If we have a whole bunch of engineers sitting in a room, they're going to take a reference point and they're going to build based on the reference, but not necessarily based on the patient or the human experience, right? So they're going to do something wonderful and cool, and it's going to be amazing, but is it actually going to be effective? And I think that's where we as DBHs, me in the future, the rest of you here today, where we can have a real impact on how this technology is utilized to actually advance healthcare. We cannot just have MDs being the product designer. We cannot just have clinical mental health or a chiropractor being the, right? We've got to have all of us together, the providers and the patients sitting in a room together so that we can design something that is really effective from so many different viewpoints that it's nothing but successful in the market.
Good points, Great. Thank you for sharing that. What are some of the biggest challenges you have seen faced in integrating artificial intelligence and technology into traditional healthcare settings, and how can they be overcome?
That's a very that's a $1 million question. That's a question I always try to avoid. I do. I try to avoid that question, but I'll be brutally honest. From my experience, resistance to change is one of the biggest challenges. Providers want their workflow simplified, but there's just not enough time. There's resistance from providers and there's resistance from patients. How do you address that? A lot of times organizations don't have a clear pathway for this change. So their change management process is often complex and the communication is not clear enough. And the time for the transition is often not realistic. So that's one of the biggest things that I see. As they're addressing this resistance to change, staff training is often included in the most simplified way of an hour training, or just learn this, or here's a support desk to train you. But adapting into artificial intelligence is not just about training, it's a culture change.
Right.
It's a change that has to do with your brain also. Providers used to going in and talking to his patients and typing. We forced providers to do this for several years, and all of a sudden they no longer have to do that. They feel weird for a little bit, right? You want to do what you're used to. So of course, it's going to take time for providers to adapt and accept this change. So I think it's just having a really good, realistic change management plan, program, and communication would really help. The second thing I really see, which I think is another big barrier, is cost. The initial cost of implementation is often high for a lot of the providers. And providers, which I think a lot of tech companies don't realize this, is a CFO, a CMI, or Chief Medical Information Officer, and other clinical folks in the company often get technology people who are trying to sell them things. A lot of times they buy technology that they never use. I can speak to that because I have seen that happen, and we have done that too. I've seen providers buy 50,000 licenses and even forget it exists, right? So the cost is often high. So you often see the C-levels or VPs resist spending this money without knowing what the ROI would be, right? And because a lot of technology has been shoved in their face. So I've seen a lot of this been resolved with, prove to me your technology works. Let's pilot it. Let's see if the ROI works. Let's see how easy it is to adapt, to implement, and to sustain. And then we can go ahead, excuse me, and implement this on a larger scale. But those are the 2 or 3 main experiences I have seen.
Okay. Wow. Thank you for sharing it.
Touching on on cost, the payment structures don't necessarily support the use of technology. Not
Ah,
thinking about AI in particular, but for example, with secure messaging through the EHR, more and more providers are getting inundated with extra communication from patients that typically the patient would have to schedule an appointment for. So it's great for the patient, but you're not then able to actually bill for a visit for that
mhm,
encounter.
mhm,
So I just wanted to add that onto the cost piece of things. There's also difficulty with the different technologies actually communicating with each other. I forget the numbers, but I know that there is some wildly high number of different EHRs that different
mhm.
healthcare organizations use. There's thousands and thousands of different mental health apps out there, and these technologies aren't communicating with each other. So if a person sees their primary care provider in one uh, health system and then maybe they have physical therapy somewhere else or
Mhm.
a heart specialist somewhere else, and they all use different EHRs, then their primary care provider, who's supposed to be the kind of the hub,
Right.
doesn't have access to all this information.
Mhm.
But the biggest challenge that I get excited talking about is the ethics behind all of it.
Mhm.
So are we are we able to kind of explain the algorithms that are used by the AI in
Mhm.
making diagnoses or treatment recommendations? Some of these technologies, we don't know the harms that could come because we just don't have the data yet. So being able to kind of weigh in on how much is using the technology going to benefit patients versus these potential harms that could come. Um, and one of the big things also is the potential for health disparities and inequities to be increased. So technology could potentially help to improve equity in healthcare, but we know that technology literacy isn't equal and access to technology isn't
Right.
equal. So
Mhm.
uh, we're focusing on technology to kind of solve this, provider shortage and not focusing on recruitment, retention of human providers, and not focusing on the infrastructure that would allow the technology to actually improve health
Mhm.
inequities.
Gosh, I think I'll piggyback on what you both are saying because there's a when we think about the integration, the API, the application programming interface that allows two different systems to connect, that is actually the way that they're not connecting today is actually a reflection of how our healthcare system works,
There
right?
you
So
go.
it's actually
Right.
probably consistent with the way that we're working, which means that the integrated healthcare consultant or behavioral health doctors of behavioral health have a great opportunity to kind of break through some of those barriers if we can get the leaders of those organizations to hear from us and move in a direction where we can create a system that um, um, relies on horizontal integration
Mhm.
of
Mhm.
data. And so right now we have a vertical integration of data, right? It stays within the system. It's not shared necessarily widely across all platforms. And there's a big opportunity for change there. There's
Mhm.
another big gap that I think that we have in the healthcare and the clinical healthcare training that exists, which is teaching clinicians how to
Mhm.
use technology. I have,
Yes.
maybe I'm wrong, could be completely wrong here, but I have never heard of any program ever having a course dedicated to the use of technology in healthcare. I just have never heard of it. I know in my clinical training, we didn't have it across across education right now. We have a
Mhm.
great big massive fear around utilizing generative AI in coursework, right? So there's a lot of these sort of opportunities that our training can provide to us. I'm thinking back to kind of early in my healthcare expansion of my career, just trying to bring in some very basic tech systems into a clinic, and the folks around me didn't know how to use them. I mean, we're
Mm.
talking like a Google Sheet, right? We're talking about really basic technology. and the clinicians around me having no idea how to navigate through these tools. So I think that we have an opportunity to teach healthcare providers and train them on basic technological applications that can actually advance their abilities with patients, and also to accept then the the use of technology in a way that is ethical, right? But the human brain is one that says, if I don't know it, then it's wrong somehow when we push it over there, right? It's a fear-based kind of response to things. But if you know how to use something and you know what it does, typically then you can make a decision if it's going to be effective or ineffective for your clinical practice. But if you don't have the training, you don't know what it is. I don't know how that would get there.
Exactly. What innovative approaches or best practice have you or others implemented in integrating artificial intelligence and technology into care delivery? And what results have you seen?
I would say, from my experience, the most successful approach I have seen is having a clinician and a patient-centric design. And
Okay.
what that means is, as the AI is being designed, make sure you have the right clinicians at the table,
That's a big difference.
and make sure you've also
Right.
done patient interactive surveys, and if possible, have a patient consistently at the table. And when I talk about having clinician at the table, I mean the core clinicians. A lot of the technologies out there, we often see a prescriber at the table, which is excellent, but the prescribers only know their workflows, right? We need a nurse. Nurses typically have a general view of the workflows, right? And then when you talk about other specialties, other specialties like a DBH also has a much more broader view. So we need more healthcare experts at the table, not just the prescribers. And when we're talking about the patients, we need the different views of the patients for the technology being developed. I would say if you're developing a technology for youth, it's okay to have a youth-centric voice. If it's a technology that impacts everybody, then you want to have all generations presented at the table. This type of designs I have seen success, specifically, I'm not going to mention names, but I've collaborated with a partner where their design was based on this model. They have a therapist at the table, they have a prescriber at the table, and they surveyed all the youth in their neighborhood. And also youth on TikTok who helped them design this technology. And it's not a one-time survey, it's an ongoing survey. These youth are able to tell them, I'm not going to use that. That's boring. Why would I do this? This youth really gave their feedback, and that technology is phenomenal. In my opinion, that's because of how they designed it and how they continue to improve and optimize the technology with the voice of the patients and the clinicians.
Talk a little bit about kind of the care delivery piece. So when it's being used with patients, across the literature, there's not a lot of data out there about what exactly is effective in AI when you look at using it for treatment with patients. But one that did standing out was collaboration with the patient, the AI, and the human provider, whatever the specialty is. You need all three collaborating on care. The AI is kind of borrowing the confidence that the patient has in their provider. So if you have a person who just the patient, you kind of let them loose with with whatever the technology is that they're using, they may not have the confidence in it. They may not continue to use it. They may not see the benefit. They may not understand how it's going to benefit support them. So making sure that there is a human provider involved in the care and making sure that the care remains collaborative and not just kind of the technology making whatever recommendation without being able to have input on the needs and wants of the patient. Because if you think about like a human provider patient interaction, that
Hmm.
provider is generally going to have a good idea, as long as they've had a long-standing relationship, but they're going to have a pretty good idea what the patient's preferences are. And they're going to be tailoring their recommendations based on previous conversations they've had. The AI is going to take the patient preference last, right? It's going to go through all of the treatment options or diagnostic options and then make a recommendation, and then the patient has to kind of put in their preferences. I'm sure there's technologies out there
Hmm.
doing it differently, but that's kind of broadly how some of the technology is working. So anyway, main point is just making sure that you do have that solid collaboration with a human provider
Right. Totally
is
agree. Hmm.
a good practice.
Yeah, I think the doctors here have summed it up very nicely, and I would add just a different view, just one more little perspective to it, which is about I'm mostly interested in small, medium-sized practices because about 50% of our healthcare in the United States continues to be in the small, medium-sized practices, although we see, for example, physicians migrating very quickly to large corporate-owned and hospital-owned systems. And so the money exists in big systems.
Hmm.
The money exists in private equity. The money exists in venture capitalism to develop these types of products. The
Hmm.
challenge is if we're developing particularly just for hospitals, or we're developing for large corporate-owned systems, we're not able then to financially achieve um, success for small and medium-sized practices because these technologies are very expensive. When we look at large EHR systems, a one-person private practice counseling, private counseling practice isn't going to be able to afford the thousands of dollars that it takes to implement an EHR. That isn't even talking, by the way, to across to other horizontally, as we said, to other EHRs. So I think that we need to do more around for these technologies to be effective en masse. I think that we need to do more around funding for small business, small and medium-sized practices, so that we can actually reach the patients that are
Hmm.
not interested in going to the large systems. And we know that those patients tend to be more, if we think about this from an intersectionality kind of point of view, we're going to see those patients being more on the oppressed side. And so this technology actually has,
Hmm.
without a focus on small and medium-sized businesses, this technology has the effect, potential effect of actually widening the health equity gap for many of us. And so I just encourage anyone who's listening to make sure that we are looking at how do we reach small, medium-sized practices, or else we're kind of, circling the drain on who can afford it rather than maybe who can benefit from it.
Hmm. Thank you. Thank you for sharing that. And our final question here. What future innovations do you see in the integration of artificial intelligence and technology within healthcare, and how could they impact the entire industry?
Is limitless. The future is limitless. In
Right.
all honesty, I think, in my opinion, the future would be that we all either have to accept and adapt AI, or we have to go home. We really have to do it.
Right.
But to specifically to your question, I think it really comes down to personalized medicine. Some people call it clinic at home. Some people call, there are different names for it, but I believe it really comes down to personalized medicine. I see us being able to use our cell phones. And I have also seen this, I experienced this, where people can also use their glasses for diagnosis. Just by putting the glasses on, you can do a scan of someone and be able to see
Mhm.
some things.
Wow. So right.
And that's where the personalized medicine is we will have it within our reach. At the end of the day, it's really going to come down to the
Mhm.
rapid adoption by individuals based on cost and digital education and literacy. But it's here, and it's going to be very, very accessible, and hopefully we can afford it.
Right. Good. Thank you. Thank you.
Jumping off the idea of precision medicine, one of the things I'm really excited about for behavioral health is they're working toward precision psychiatry. So
Mhm.
a number of things are happening, and I will try and narrow down to the things that I am most excited about. But one of the things that I think is really going to revolutionize diagnostics and treatment is with AI and the ability to look at large data sets and a lot of information across uh, different platforms of EHRs or social media or wearable devices. There is hope that we're going to be able to really start diagnosing based off of cause rather than symptom
Mhm.
clusters.
Mhm.
So right now, one of the big challenges that we have is DSM diagnosis is really off of what humans can perceive and identify. So it's these symptom clusters. And there's a lot of similarities between diagnoses. And even then within one diagnosis, there's also differences for each person because the reason behind the diagnosis is different. So I am so excited when we're going to be able to use technology more to look at what is truly going on for this person, and then be able to make a more personalized treatment recommendation. And with that, the thing that I'm excited for there is there's work on databases that will be able to look at genetic information and make medication recommendations. And I know some of that's already happening with like GeneSight and that sort of thing, but there is a lot
Mhm.
of work toward developing an even larger database to get even more precise treatment recommendations. So I am really excited for where that's going to go.
Okay.
Practically speaking, I think that we have to recognize the value of information, right? We always say whoever has the information has the power. And so the opportunity, and I think that we're here with large electronic health records, developing health information exchanges. So to the point earlier made around connecting horizontally the data, we can do that. We can do that right now. We can do it today. Those things can happen. The challenge is around the financial power that comes through holding the data, right? And so if that data is being shared across a number of different companies or a number of different devices, then we have to figure out what is the monetization of that information being shared. And I think that's one of the barriers that we have to overcome for
Mhm.
truly for AI to be useful in a way that accelerates holistic healthcare for the person. And once we can figure out how to share that data in a way that is fair and equitable, financially fair and financially equitable across businesses, then I think
Mhm.
we would probably see an acceleration to Star Trek, right? Like we've all seen it. We all
Right.
know we just get a little recorder and there it is. But
Right.
but I think that we have to figure out the finances around this to really move faster.
Thank you. Thank you. Thank you. Thank you. Thank you for taking the time to uh, help us explore this AI world. As mentioned, it's not going anywhere. Thank you for sharing your insights and being panelists today. I'm quite sure we're going to continue having this conversation. AI is here, and it's going to be amazing to see what the journey will be and how things will turn out. I'm very excited to seeing. So I would like to thank you, Dr. Kumalafe, Dr. Such, and Jeremy for being such great panelists today. And I will like to say thank you to the audience for coming. Please like, share our podcast. And I can guarantee you this AI conversation is not going anywhere. So you'll see it some more in the future. So thank you all for coming out, and we'll see you at the next podcast.